Good morning to all my fellow plebs out there. Hope you guys are all having a great day. I got a couple hours here before work, so I'm going to try and get a video or two done here at least before work. Um, the first video, or at least the one at least I'm going to get done before work, at least one of them, is this one right here. Today I found an article about my buddy. Been asking a guy at work kind of where he's been, and he keeps saying he's witness protection. I don't know if that's true or not. It might be a little bit of a conspiracy theory, but there could be some truth to it. I think he's in some sort of care like that though, because like I said, I haven't really heard from him. But all of a sudden now, today and last night, even at work, I seen that there's a little bit of talks of him, making an appearance here again, with us all. So, without any further ado, let's go ahead and jump in the article here and see what old Fauci's up to these days. All right, so right here it says Fauci says COVID-19 cases will likely increase soon, though not necessarily hospitalizations. Over the next few weeks, the U.S. should expect an increase in cases from the BA.2 variant. Some of these names that they're coming up with, these variants, are something else. I mean, we had the Omicron, Delta, and now the BA.2 variant, and I just don't know where they're getting these names at. So anyways, Dr. Anthony Fauci told ABC News, but it may not lead to as severe a surge in hospitalizations or deaths. I would not be surprised if in the next few weeks we see somewhat of either a flattening of our diminution or maybe even an increase, Fauci told ABC News' Brad Milkey on the podcast Start Here. His prediction is based on conversations with colleagues in the UK, which is currently seeing a blip in cases, Fauci said. The pandemic trajectory in the US has often followed the UK by about 3 weeks. However, he added, the intensive care bed usage is not going up, which means they're not seeing a blip up of severe disease. So I'm not really sure why he's throwing a big deal. I mean, let's see here. Maybe there's something else going on with the more minor issues. The BA.2 variant, a more transmissible strain of Omicron, now represents around 23% of all cases in the U.S. According to the latest data from the Centers for Disease Control and Prevention, and while Fauci predicted that the BA.2 variant will eventually overtake Omicron as the most dominant variant, it's not yet clear how much of a problem that will be. Whether or not that is going to lead to another surge, a mini surge, or maybe even a moderate surge is very unclear because there are a lot of other things that are going on right now, Fauci said. Similar to the UK, much of the US has recently relaxed mitigation efforts like mask mandates and requirements for proof of vaccination. At the same time, people who were vaccinated over 6 months ago and still haven't gotten a booster shot, which about half of vaccinated Americans, according to the CDC, are facing continuously waning immunity. It's also not yet clear how long immunity from prior infection will last, Fauci said. So we're back to the jab, the poke, however you want to put it. I'm getting tired of that dinosaur medicine. Taken together, it's why Fauci and other experts, including CDC Director Rochelle Walensky, have increasingly predicted that elderly people will need a second booster shot soon. The FDA began reviewing data from Pfizer on the safety and efficacy this week, and its advisory panel will debate if and when the additional booster shot is necessary in the coming weeks. I really don't know how receptive us fellow American plebs are going to be to them wanting to try and get us to use a booster. I know there's a guy at work also that said, I think he had 3 of the jabs or the pokes, or however you want to say it, and he said he's done. I mean, he said if it ain't going to stop a breakthrough infection with how sick it makes him get, he said it's not worth getting the jab or the poke. I mean, I just don't know how people are gonna tolerate this much longer. That's my main concern right now. And then you got I don't know if I should even bring this up. They'll probably ban me for this. You got the truckers going on and that whole thing, and I don't know if the truth is coming out there. but it's just time that time in America where we're just divided so bad. It's kind of sad, but let's get back to it. At the same time, Fauci urged Americans who haven't yet gotten their first booster, which would be their third shot in the Pfizer or Moderna series, to do so. A resurgence of cases could also mean Americans are asked to wear masks again, which Fauci predicted would be an uphill battle. From what I know about human nature, which I think is pretty much a lot, people are kind of done with COVID, Fauci said. Yeah, see, that's exactly what I was saying. Still, he defended the CDC decision to loosen its mask recommendations earlier this month by shifting to a strategy that focused more on severe outcomes, like hospitalizations and deaths, rather than on daily case spread. I mean, yeah, I think we're getting to a point now where the worst of it should be done. I mean, I guess it could evolve or transition into something more severe, but it just seems like as each variant comes out, this this virus just seems to it's been mutating to less and less severe. So I think it's just time that we got to move on, just kind of accept it's always going to be there and just going to be another cold and flu. You can go ahead and continue to tiptoe towards normality, which is what we're doing, but at the same time, be aware that you may have to reverse, Fauci said. And if the U.S. does continue to make its way back toward normal times, Fauci himself has a personal choice to consider. At 81 years old, the director of the National Institute of Allergy and Infectious Disease is certainly thinking about retirement. Yeah, I think it's definitely would be a wise choice for him just to go ahead and step down. I don't think that'd be a bad idea. I have said that I would stay in what I'm doing until we get out of the pandemic phase, and I think we might be there already. If we can stay in this, Fauci said, referring to the falling cases and hospitalizations in the U.S. My personal take on that is he's just trying to profit from this. As soon as the money to be made from this is done, that's when he's ready to step down. That's how I'm taking that. At 81 years old, this guy should be ready to enjoy his life. Instead, he's trying to, it just seems like he's trying to keep us all locked up. I can't stay at this job forever unless my staff is going to find me slumped over my desk one day. I'd rather not do that, he said, laughing. Yeah, that's what I was saying. He needs to enjoy his retirement before that does happen. I'm sure he's made plenty of money. While he doesn't currently have retirement plans, the recent hire of Dr. Ashish Jha, Dean of the Brown University School of Public Health, to be White House coronavirus coordinator could alleviate some of his pandemic response duties and give him a window. So we already got someone ready to take over for him, or okay. I thought he was like an elected official. But Fauci, who has dedicated his career to public health, primarily studying HIV and AIDS, and worked under 7 U.S. presidents, said he doesn't have any particular hobbies waiting for him in retirement. I, unfortunately, am somewhat of an unidimensional physician, scientist, public health person. When I do decide I'm going to step down, whenever that is, I'm going to have to figure out what it is I'm going to do, he said. I'd love to spend more time with my wife and family. That would really be good. Well, I think that would be good for all of us if he would just go ahead, step down, and ride off into the sunset and enjoy the time with his wife and family. I mean, you're 81 years old. Before long, you're going to be on your deathbed, and you're just going to realize that you essentially held the American people down this whole time, in my view. I mean, this is all my opinions. Ain't facts, just my opinion here, so. But. So, go ahead, comment on this, everybody. Let me know what you plebs think about Fauci trying to make a comeback here. I think he's trying to make one more financial stab at this, and I think he is going to be stepping down, though, before long. I think he's got someone in the old ear here telling him, you know, it might be wise, just go ahead and step down. I'm shocked he has no hobbies, though. It's kind of weird, but I guess when you're the way he is, though, he was just devoted to his job and to what he did there. So I guess he really didn't do anything else besides spend time with his wife and kids, but I guess that's what he's going to do in his retirement. So Well, if you've plebs made it this far, go ahead, like, comment, subscribe. I would like to have your lifetime pleb membership there if you hit the subscribe button. So until my next video, you guys have a good one. Take it easy, everybody.